Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. I'm Mike McKee and my guests on the program today are Mark Lander, the director of the Florida Department of Health, Columbia County Health Department, and Diana Simon. She's a senior community health supervisor, a registered nurse. We're going to talk about what programs are offered at the health department here, some that you may not have known about. We'll talk about that when we come back. Don't go away.
For a while, and you get to know a few things. Like, I know she's actually not a morning person. I know she does strange tricks for no treats. I know that water makes her howl like crazy. I even know how the floor stays so clean. She's quick. But the one thing I will never for the life of me know is how she gets so tiny and inside that box. Natalie, how do you get so tiny?
Welcome back to Perspective here on Florida Gateway College Television. My guests on the program today are Mark Lander. He is the director of the Florida Department of Health, Columbia County Health Department, and Diana Simon is a registered nurse. She's also, her title is Senior Community Health Supervisor. Welcome to the program.
Thank you, Mike. We appreciate it.
You know, a lot of people, I guess most counties in the state, or every county in the state has a health department, but a lot of people don't know what the health department does. And you and I, we were talking before we came on the set to do the show, and I like 2 pages of notes that I'm looking at. But in a nutshell, what does the health department do? What are you tasked with doing?
Well, that's right. Really, the health departments are tasked for promoting and the health of the residents of not only their county, but in the entire state of Florida. And you know, a lot of times people think, well, the health department, they'll go see a physician there. It's more than just that. That's our primary care physicians are a very small part of our medical side and educational piece that we actually run at the health department. From medical, we have what we call core public health functions, which every health department in the state will participate in, which are immunizations. We have disease surveillance, our communicable disease surveillance. That's STD, HIV surveillance. We also have family planning. Those are some of our core medical functions that we do.
Well, Diana, I want to ask you, the immunization is very important. If you don't have immunizations, disease could spread through a community. You could have an epidemic of.
Right.
Talk about immunization. What type of immunizations are available through the health department?
We have a Vaccines for Children program. It's a federal program that we provide at the health department for children under the age of 18. So anyone under the age of 18 can have their vaccines at no cost to them. They include the school entry required vaccines, anything for daycare entry, and even their booster shot for middle school. We do encourage them to get them on time and stay up to date to prevent any outbreak of any of the vaccine preventable diseases. We also have a program for anyone who did not get them under the age of 18 for adults 19 to 26. And the 2 that are included in that program is going to be the Tdap vaccine and the HPV vaccine. So anyone from the age of 19 to 26, they can get it for the administration fee of $10 for that program.
Most colleges and schools, when there are going to be a group of kids or young people together, they require immunization, up-to-date immunization. And do you give immunizations for those who can't either find their records or are not sure whether they got immunized?
Yes, we do provide those vaccines, and yes, there is a college requirement if you're going to live on a college campus, is the meningitis vaccine and the hepatitis B vaccine. So they do have an option to opt out of those 2 vaccines. However, if they do want to catch up on their hepatitis B vaccine, that's available at the health department. But it's important to stay up to date to prevent any disease outbreak.
And when you're talking about immunizations, it's 3 or 4, or how many are there now? I know that do they still do rubella?
We do. That's included in the MMR, the measles, mumps, and rubella. We have the DTaP. We have Tdap for booster shots. And many adults don't know that we do vaccinate against chickenpox these days. So you don't see a lot of outbreaks of chickenpox anymore because we do have the vaccine. So we do have a chickenpox vaccine, polio, and the one we would like to catch everyone on up is the adults is the pertussis vaccine, and that's included in a Tdap vaccine.
What is pertussis?
We know that one a lot commonly as a whooping cough. So
Okay.
we want to prevent the whooping cough, especially in infants and children.
Mark, as director of the health department, during cold and flu season, which we are in, you see a lot of folks coming in that are just miserable, and there's nothing, when you go to the health department or you go to the doctor when you have the flu, there's something seriously wrong, and so you see a lot of that now?
Yes, and when you have the flu, you know you have the flu. Someone may say, well, I was sick with the flu, I went into work. No, it will really knock you back down. We started promoting our flu vaccines back in October, and it was vaccine before Halloween. And it's getting the understanding is that flu vaccination is not only to protect yourself, but it's to protect your family, your friends, your community. You get vaccinated, that offers protection to you, and then you cannot spread that virus any further. And so that's and we see peaks with the flu. We see coming into November, December, we'll start to see a peak. We saw a peak the last 2 weeks in December of the number of reportable flu cases in our community. We expect another peak, and it's not too late still to get that flu vaccination. If you haven't received it, you can come into the health department, call your private provider, and many of the pharmacies in the area still offer the flu vaccine.
No charge at the health department, correct?
The health department, Diane, I think it's for...
We do charge a $20 fee for the flu vaccine. However, if you have Medicare will pay that for you. We still have some available. I know some providers may be out of the flu vaccine, but we still have flu vaccine available. So if your provider has been out, or your pediatrician for the children, we do have the vaccine available in stock.
Now, you guys know when there's the flu outbreak, the health department normally knows because you see the most cases of the flu. And let me ask you, do the hospitals report to you as well that there are a bunch of flu cases coming?
They do. Many infections and diseases are reportable to the Department of Health, and the flu is one of those. So we do get reports from pediatricians, from hospitals, urgent care centers. We do get a large number of cases that are reported.
Now, is this because the state needs to know if there is a bad outbreak, or if there's something out there that is going to harm the public health?
Right.
That you're prepared?
For surveillance, so we want to keep a surveillance of any disease outbreak, and that's just to get to the source of the infection of any disease. That it doesn't always have to be the flu vaccine; it could be other infections, just to prevent an outbreak.
And that's where the health department comes in, because if there is an outbreak or there is an epidemic of a certain bug that's out there, you're going to be on the front line helping sick people who can't do for themselves.
If you look back, the health departments were established. We celebrated our 125th year anniversary last year, and it was due directly to disease outbreak is why your health departments were formed, for surveillance, for control, for education, and really to investigate these outbreaks, to determine root causes, and to stop the spread of communicable and these diseases in our communities.
Also, you do testing for disease. I mean, HIV. You do HIV testing, which is confidential, and it's a free test.
It is. HIV testing is always free, available at the Department of Health. Other STD testing includes testing for gonorrhea, chlamydia, and syphilis. You can come in for a visit with the doctor into our STD clinic, and all the testing is confidential.
And we have counselors, these counselors that are there to provide that information and to work with you, with those test results.
And again, an outbreak is something we don't want, and so that we can keep a track on it. You don't want it to go through the whole community, just not healthy.
Well, and that's a big part of our STD surveillance in that program. We may get a test result that is a positive result. At that point, our counselors work with that individual contacts. We look for contacts trying to stop the spread of that disease, and we work with them, and it's all done confidentially.
Now, Diana, in addition to those types of things, you also will see someone as a primary caregiver as well, correct? If
Yes.
somebody, just normal checkup, family checkup, child's
Right.
checkup.
Right, so we do have primary care at the clinic, adult health, including a physical exam, screening for diabetes, high blood pressure, thyroid screenings. We provide those services at the health department. Also, we have a family planning clinic, including female health. We provide yearly exams, pap smears, and birth control methods.
Well, and again, it's not all free. I think there's a misconception that every service at the health department is free, but it's not.
Right.
It's there are charges and there are insurances.
We do take insurance. We take Blue Cross Blue Shield, AvMed. We take Medicaid, and then if you don't have insurance or Medicaid, we do. It's based on a sliding fee scale, so you could be anywhere from 0% anywhere to 100%.
Right, so technically, depending upon your income and how that sliding fee scale works, you could go down to, it could be free. It could be a free service that's provided based on your income. And it's important, one of the things that, to know is we have the main clinic here in Lake City, but we also have a satellite clinic that we operate every Thursday down in Fort White that we do primary care and family planning down in that area.
So, but you do walk-ins as well. I mean, if someone is ill.
Oh yeah.
And then you do a thing called triage. You figure out what's wrong with them, and if they're too seriously ill, they go to Lake Shore.
Yes, we see them, take a quick assessment. If they do need emergency medical care, we do send them to the local and the nearest ER.
Okay. I wanted to talk about some other things. You do preventative health as well. And Mark, you and I met for the first time on an initiative that Altrusa started. But the health department was on the forefront of healthy weight.
Right.
And some statistics that were done were kind of shocking about the number of obese people that live in our community.
It is really amazing, and that's right. Yeah, you and I had met last year and on a committee about this. And in response, if we look at right now, the number one public health threat in Florida is obesity. I mean, currently only 36% of all Floridians are at what's considered a healthy weight. Here in Columbia County, we're less than 30%. We're around 29% of what's considered would be a healthy weight.
You know, it's when you say 70% are overweight,
yeah.
it's a stronger message than
that really is. I mean, yeah, so 71% of everyone in our community is considered at an unhealthy weight, and it does bring it home. And then, right now, if we continue on this current trend, 6 out of 10 children who are born today will be obese by the time they graduate high school.
And Diana, we're talking about some serious medical issues that being overweight causes.
Right. Medical issues that could be addressed at the Department of Health in our primary care clinic, screenings that we can do. And we also provide counseling and education during your visit on healthy weights. So it's great to join these programs in the community, but we also address the issues there at the health department.
And to add on to that, I mean, when we talk about it's the disease itself and protecting yourself, but estimated healthcare costs. We're looking at over the next 17 years in Florida alone, our costs could exceed $34 billion preventing these obesity-related issues such as type 2 diabetes, heart disease, obesity-related cancers. And so that's what prompted the Florida Department of Health to start Healthiest Weight Florida. It's a great website. It's www.healthiestweightflorida.com, where you can go on and see what's been done across the state and in our community to address these health issues. It's really a private and it's a private partner, state, local governments, and community partners getting together to shift our community's focus on living healthier, eating healthier, and really active lifestyles. And we've seen changes across the state of Florida. I tell you, one of the things our community does step up to the challenge when presented, And just this year, Columbia County, Board of County Commissioners, and our county was considered one of 65 community champions across the state of Florida. And that's just in the entire state. We were one of 65 communities recognized as a healthy weight champion, and it's called a healthy weight community champion. And that was based on our comprehensive plan, how we trying to incorporate sidewalks into development, and then also on our parks and recreation systems that we have in the community. But it's really an honor to be recognized, to know that we are working towards becoming a healthier community.
Now, Diana, if people are if you explain to people what's happening, do they understand it better? Rather than just stop eating, to
Right.
eat the right foods.
Right, and it does take sometimes some overtime to discuss this a few times rather than just doing it all at one time, in order to absorb and process the information. So we discuss healthy eating and exercising. You don't always have to pay for a program. Taking a walk is going to be exercise.
When we had that Healthy Weight Forum out here, we had some people from Union County that were here from part of the college. They don't have sidewalks. They don't have running trails. Rural communities, if you want to go to a pasture and chase cows, that's one thing, but they made a great point that a lot of these rural communities that have folks that are overweight, there's no option for them. They don't have a Anytime Fitness or a gym that people can go to.
Right, and that is a struggle, especially in the smaller rural communities. Even in all, we're not one of the smaller, we're rural, but not one of the smaller rural communities around. I also work up in Hamilton County as the administrator for the Florida Department of Health there, and you really have to start looking for options that are available and the partnerships that you can make. Recently, we partnered with Stephen Foster State Park up there for a program called Stepping Out for Health at Stephen Foster. If an individual, they don't have to be a health department client, if they come into the health department in Hamilton County and ask for, or if we do a BMI on them and they are at what's considered an unhealthy weight, they get a free one-day pass to get to the park and use it for exercise. And we intend to do the same thing down here in Hamilton County, in Columbia County, work with some of our partners, the state park system, anybody who's willing to support a program like that with us. And it does offer additional opportunities to exercise that currently aren't out there. You're right. These smaller counties, they don't have the gyms. They don't have those exercise options that are really needed.
Mark Lander is the director of the Florida Department of Health, Columbia County Health Department, and Diana Simon is a senior community health supervisor and a registered nurse at the Columbia County Health Department. I wanted to talk about some programs for kids as well. You have, I guess, Healthy Start program is
right. It's a program that's geared for pregnant women or who were recently pregnant and children under the age of 3. So it's counseling and education again, because we want to have a good outcome for their pregnancy and have a healthier child and a healthier mom. So we have counselors there at the health department that you can come in to see. A healthy screen is going to be conducted probably at your OB visit. If you meet the score requirement, you automatically can join Healthy Start, but you don't have to meet the score required. You can do a self-referral to join the program. For the counseling and education, you can come to the Department of Health for talking to one of the counselors. They can make a home visit if you would like, or they can meet you at a doctor's office. Whatever is convenient for you to provide the information that you need.
The health department isn't a replacement for an OB/GYN, correct?
Right.
But do people do that sometimes, that they can't afford to go to an OB/GYN, so they rely kind of on the health department to?
If they need family planning services, yes, we do provide those services. A lot of times they do have their own OB/GYN doctor, but they do refer them to us for counseling and education in some of these programs that we can provide extra support.
Now, if somebody came into our office and was trying, if they needed the OB/GYN service, the prenatal care, we have a referral sheet and this referral sheet is for individuals who may not be able to afford that. So there's some Medicaid physicians in town, as well as other options for individuals who may not be able to afford those services.
I've been a part of the March of Dimes for many, many years, and they preach prenatal care, and that the mamas need to be doing certain things to carry their pregnancy to term versus
Yes.
having a premature birth. And so it's
Yes.
very important. I know as a registered nurse, you probably see a lot of young
Right.
people who maybe not doing what they should be doing.
Right, and so and part of what the Healthy Start program does is they provide a childbirth education class. And this is a service that a lot of people don't know about. We do provide childbirth education classes. It's free, no cost to the couples who come. It's put on by Healthy Start. So we do go over some relaxation techniques, breathing exercises, anything that has to do with childbirth and labor. We encourage them to bring their spouse. It could be a family member or a friend, whoever is going to be their labor coach. During those classes, we talk about nutrition, whatever mom takes in, baby's getting also. So we talk about healthy habits. We talk about terms that they may see or may hear at the hospital during labor, but just to give them information so that they're prepared for childbirth. It's a 6 weeks course. 6 weeks to give you the information over amount of time where you can absorb the information and process the information, make a birth plan so that you're prepared. We give you information so that you're aware of what's out there, not to steer you in a certain way, but to guide you, give you the information. The class is a discussion. We have open discussion, answer questions. We have many questions that are asked. No questions are off the table during the childbirth education class. We do provide videos so that you can see a story of the birth process.
All right, and another thing you administer and you just started is the WIC program. Let's talk about what WIC stands for. Some people, and I guess that we're going to go to Diana again.
I'll let Diana handle WIC.
WIC is the Women, Infants, Children. This is a program geared for pregnant women, women who have recently been pregnant, and children under the age of 5. They provide a food card where they can go to a local grocery store and buy food. Some of the food items include milk, eggs, cereal, fruit or vegetable juices for pregnant women. They encourage breastfeeding. It's the best nutrition for baby. It's healthy for mom. And if for some reason you're unable to or choose not to breastfeed, they do help supplement with formula.
And to follow up on WIC, as you were saying, in the past, for many health departments have the WIC program in paternally. And what we had here in Columbia County and in North Central Florida was a contract. And just recently, we've taken back that the contract where it is now being administered from the health department. You could always come into the health department and get those WIC services, but now it's actually being a health department program here in Columbia. And Diana brought up a really great point. The studies have shown babies that are breastfed tend to be healthier babies. We actually have a breastfeeding counselor at the health department in WIC that's there to work with the mothers and try to help them the best they can. So that is a valuable resource.
All right. In addition to all that, you guys do environmental services, and we briefly touch on that. That's making sure there's clean drinking water, and that there's no bacteria outbreak in wells and certain things like that.
Absolutely. You talk about preventative medicine. I came up from the environmental health side, and I always considered environmental health. It's really it's a preventative care for the fact that we do septic tank permitting, drinking water analysis. We have our own lab here at the Columbia County Health Department over in our environmental section where we test for bacteria in drinking water. And what we try to do is a lot of sanitation inspections. We're trying to prevent disease outbreak by ensuring conditions don't exist to create the disease. And that's the big part of our environmental section. Environmental, we also have a public health planning section where if diseases threaten our state, our planners work both locally and at the state level to ensure that we have a plan in place to identify the disease, isolate it, and then inform the public and inform the community on the dangers.
You also, this is kind of a cool thing, you keep statistics. All the health departments compile statistics about certain communicable diseases, and then it's sent to the state
Right.
of Florida, and then the state of Florida disseminates that information so you know what's going on in the state.
Absolutely. We have Florida Charts as one of our systems that plenty of information, anything from our breastfeeding numbers to any health statistic, cancer related, any type of statistic that you want to find in regards to like communicable diseases. We have that information on Florida Charts, and then Diana also works with several other reporting systems that track these communicable diseases. That information is out there.
Right, so we get the information from our local providers, which we have, it's very important for us to work closely together so that they report the diseases, infections. We then, in turn, gather the information, do an investigation. We want to consider if it's an outbreak, how we're going to prevent it, how we're going to treat those who are ill, and make sure they have medical care and to prevent an outbreak. We then report that into a system, and it's reported to the CDC, and that's where we get our numbers from.
We've only got a short time to the end of the program, but I wanted to find out priorities for 2015.
Priorities for 2015, we've kind of touched on them. Number one, preparedness. We're going to continue with our as I know my two planners are in trainings today. As a matter of fact, it's always learning how to be better. Hurricane preparedness, for any time of natural or man-made disaster. So that's one of our priorities. We're going to continue on pushing. We have to move forward with healthiest weight. Yesterday, we just released a new initiative called Healthy Promise Campaign, and it can be found at www.healthypromisefl.com. And it's an interactive campaign that's going to encourage individuals to. It's a posting website. You can post your promise or your encouragement story for others and pictures, and it's really understanding that we're not in this alone. This is, healthy weight is not just a me challenge. It's a statewide, a national challenge, and a statewide challenge, and there are others out there. So those we're pushing with preparedness and really moving forward with our healthy weight initiatives to get the state of Florida at a healthy weight.
And if you would like more information or if you'd like some help, and you can contact the health department. They're located at 217 Northeast Franklin Street. You can log on to the website at columbia.floridahealth.org. Mark Lander, Diana Simon, thank you so much for being on the program today.
Mike, we appreciate you having us. Thank you.
And thank you for watching Perspective here on Florida Gateway College Television. Until next time, I'm Mike McKee. So long.